my name's Leanne Hanson. I'm the unit manager for the Early Pregnancy Assessment Unit at Rotherham Hospital. The Early Pregnancy Assessment Unit is run by nurses and midwives, and we see ladies with problems in pregnancy such as pain or bleeding up to 19 weeks and 6 days gestation. Every lady's symptoms can vary, and the care that you will receive will be individualised to your needs. So you can get an appointment in the Early Pregnancy Assessment Unit either via a self-referral, where you can contact the unit and you will be assessed over the phone by a nurse or midwife. You can also be referred by your community midwife, your GP, or if you attend the UECC at Rotherham Hospital, they can also make a referral for yourself. At your appointment at the Early Pregnancy Assessment Unit, you will be assessed by a nurse or midwife initially. You will then possibly have an ultrasound scan and maybe some blood tests and other investigations. Your care will be explained, whether you need follow-up or whether you can be discharged back to your community midwife. The EPAU unit is based on Ward B11, the gynaecology ward in Rotherham Hospital. Unfortunately, we are not a walk-in service. If you require any care or advice, please contact us on 01709 427072. Your relatives will be able to attend your appointment at the Early Pregnancy Assessment Unit. However, in the times of coronavirus pandemic, this will not be able to go ahead. If you receive bad news during your appointment, your partner or close relative will be allowed into the unit to support you at this time. During coronavirus, visitors are not allowed into the trust. However, if you wish to bring a relative or partner, they are quite welcome to wait in the vicinity, in the car park maybe, and we can call them if you require their support. There may be times where you need a scan in the Early Pregnancy Assessment Unit. However, this is not always appropriate for your care, such as if you are less than 6 weeks pregnant, we cannot see a pregnancy on scan, or if your symptoms do not justify us performing an ultrasound scan at that time. This will be explained by the nurse or midwife that is seeing you on that day. When you attend the Early Pregnancy Assessment Unit, you will be assessed by a nurse or midwife. Part of the assessment may include an ultrasound scan, blood tests, and any other investigations they find necessary for your care. This will be explained at the time of your appointment. After your appointment at the Early Pregnancy Assessment Unit, you will either be given advice, options of treatment, or discharged back to the care of your GP or community midwife if appropriate. You will be given contact numbers should you require any support in the future.
My name's Victoria Power. I'm a trainee advanced clinical practitioner for gynaecology at Rotherham Hospital. A miscarriage is the loss of a pregnancy, either early, which is classed as before 12 weeks of pregnancy, or late, between 12 and 24 weeks. As an early pregnancy assessment unit, we deal with any miscarriages up to 19 weeks and 6 days. Knowing you've had a miscarriage is very difficult, and the symptoms can vary quite a lot. Lots of ladies may experience abdominal pain, vaginal bleeding, or loss of pregnancy symptoms. All of these symptoms could be included, or you may have one or two. There are several different types of miscarriage. A silent miscarriage or missed miscarriage. This is when on a scan a pregnancy is still in the womb but unfortunately no heartbeats are seen. An incomplete miscarriage. This happens when part of the pregnancy, placental tissue, is left inside the womb when somebody has already passed, often referred to as retained products of conception. A complete miscarriage. This is when a patient has had a scan that's shown a pregnancy previously and a follow-up scan shows no pregnancy in the womb. Unfortunately, 1 in 4 pregnancies end in a miscarriage, and often we don't have answers for why this happens. This is sometimes very difficult for people to understand. The emotions that you'll be going through after having a miscarriage can vary a lot. Yourself and your partner will feel mixed emotions. There's no right or wrong way of dealing with the miscarriage. We can offer support if you need it in the form of counselling. You can always ring the department if you need anything. Once you've been told that you've had a miscarriage, the options that are available to you will be discussed to you by the nurse or midwife that's seen you in the early pregnancy assessment unit. They're not always appropriate for everybody, but some of the options will be expectant management, which is where we allow your body to do what it would do naturally, and we wait and let the body take whatever path it needs to. There's a medical management where we give you medications that will just encourage the process that would happen naturally, or a surgical management where we can perform a procedure either under a general anaesthetic where you're put to sleep, or a local anaesthetic when you're still awake. After a miscarriage, it's a very emotional time. There isn't anything different that you would need to do if you do become pregnant again. You'll be advised of this at your appointment. Normally, we just tell you to go about things as you would do with any other pregnancy, and ring us if you have any concerns. Lots of ladies go on to have normal, healthy pregnancies after a miscarriage. Just because you've had one miscarriage doesn't automatically mean that you're always going to have any problems. If you feel as though you're having a miscarriage, if you have any concerns at all, you can always ring the early pregnancy assessment unit. If they're ever closed, Ward B11, the gynaecology ward, is always available out of hours. So if you have any problems at all, always ring somebody. If it's an emergency and you're bleeding very heavily or you're in a lot of pain, then please attend UECC as an emergency. If you're ever unable to get through to early pregnancy or Ward B11 and you don't feel it's an emergency that requires attendance to UECC, you can try speaking to your GP or your community midwife.
My name is Mr. Faraj. I'm consultant obstetrician and gynecologist in Rotherham General Hospital, and I'm actually the lead of the early pregnancy assessment unit in this hospital. We will talk today about an important clinical condition that affects women with early pregnancy and create anxiety and confusion for both patients and actually for the practitioner or the doctors looking after the patients. This condition, we call it a pregnancy of unknown location, or PUL. And also the sonographer may tell you at the end of the scan, you may have an inconclusive scan. So what does that mean? What PUL mean and what inconclusive scan means? Right. So a pregnancy can be in uterus, which is the normal location for the pregnancy, and the pregnancy will progress as normal. The definition of pregnancy of unknown location is woman coming with a positive pregnancy test, and when women have an ultrasound scan, which is usually internal scan early pregnancy, the ultrasound will not tell us where exactly the pregnancy is. So in another word, we cannot find the pregnancy, is it in the womb or pregnancy outside the womb, which we call it ectopic pregnancy. We don't know on the scan where the pregnancy is, and that's why we call it a pregnancy of unknown location. So in another word, the pregnancy, the most common thing, it will be a normal, we call it normal intrauterine pregnancy, which is viable. Viable means we can see subsequently the heartbeat on the scan. That will constitute a highest percentage of the cases. The other possibility is the pregnancy could be failing into the womb, what we call it a very early miscarriage. This is also a common condition, affect around 20% of the women. And the last possibility is the pregnancy could be outside the womb, which we call it an ectopic pregnancy. Ectopic pregnancy is around 1 to 2% of the women can have ectopic pregnancy, and this is the thing that we need to exclude, and this is the thing that could lead to serious complications on very rare occasions. So how do we manage that? We manage PUL by initially doing the pregnancy test. That's why you are referred here to us, which is by urine. After that, we will arrange a blood test. We call it a serum HCG, which is the pregnancy hormone. And then you come for an ultrasound scan, which is, as I said, usually it's an internal scan or a vaginal ultrasound scan. You will have it in our early pregnancy unit here. From that, we can make a plan of care for you. You may ask, what will be the plan of care for me? So the plan of care for you depend on the level of that HCG. The most common plan of care with what we call a serial HCG. That means you will have another a blood test, another HCG hormone in 48 hours. So if you had it on Monday morning, you will come again on Wednesday morning for that HCG level. Subsequently, we can tell you, we think that the pregnancy is viable and the pregnancy healthy in the womb, which will be very reassuring for you and for us. Or if the pregnancy hormone coming down significantly, will tell you, unfortunately, this pregnancy may end in the miscarriage. And the last possibility is the pregnancy hormone will be plateauing or same level almost, a little bit up, a little bit down. We call it not doubling. When women have healthy pregnancy, the pregnancy hormone will double or raise by at least 66%. In ectopic pregnancy, the pregnancy hormone will be almost the same level or a little bit less, a little bit up. What will be next? What we could recommend, either follow up with another HCG, which what we call it a third HCG for you, another 48 hours. Or if you have symptoms at that time, which is pain or shoulder tip pain or pain in your belly, only in certain indication. If we are really worried about ectopic pregnancy, we offer you the options to manage that. If we think that the pregnancy hormone give us to the direction of what we call it a persistent PUL or persistent pregnancy of unknown location, in that case, we will offer you options, which could be either medical options or surgical options. In another word, we don't know, the pregnancy very likely could be an ectopic pregnancy. We couldn't find it in the womb. It could be a pregnancy outside the womb. So if we couldn't see it inside the womb and the pregnancy hormone is abnormally rising or getting less, medical options include offering you an injection. We call it methotrexate. This is a form of chemotherapy, but is a very small dose that we offer. Hopefully will control the pregnancy, which is, we think it's outside the womb or persistent PUL. You need follow-up for after this injection. You may need to come to the hospital on day 3 and day 4 and then day 7. And after that, you may have a weekly till the pregnancy hormone disappear. On certain occasions, if you have significant symptom or pain, on that occasion, we may offer you surgery. Will be in the form of laparoscopy, which is a keyhole operation, trying to deal with pregnancy. If we diagnose it in the tube, you will have an operation to remove that tube or removal of the pregnancy from the tube. You may ask, what do I need to be aware of? You need to be aware of if the possible diagnosis of ectopic pregnancy under the follow-up, while you are under follow-up, of symptoms of ectopic pregnancy. And occasionally, women may become unwell from that. The most common symptom is pain in your lower tummy, The pain may be on your shoulder tips and around the area of your back passage. You may feel dizzy, fainty, and occasionally heavy or vaginal bleeding on and off. So what we need to do in similar situation, the number of early pregnancy assessment unit will appear under the screen. You can contact them. Out of hours, you may contact accident and emergency in the hospital, who will be able to liaise with us, with the gynecology on-call team. So please feel free to do this direct communication with us while you are under the follow-up for your care. And we wish you health and healthy pregnancy. Thank you very much.
My name's Annette Brammer. I'm the ultrasound lead here at Rotherham Hospital, and the sonography team work on the early pregnancy assessment unit. When you come to the early pregnancy assessment unit, you may be required to have an ultrasound scan. We can do that scan in two ways. Sometimes we do a scan on top of your tummy, which is called a transabdominal scan. And sometimes in the earlier stages of pregnancy, we need to do an internal scan, which is called a transvaginal scan. For the abdominal scans that we do, we often ask ladies to fill their bladder up, so we might ask you to drink some water before you come for the scan. We will uncover your lower half and use some tissue, and we use some ultrasound gel on your tummy and move the probe around to get the pictures that we need. If we need to do an internal scan or a transvaginal scan, we ask you to pop along to the toilet and empty your bladder and then come back through. You have to get undressed for the internal scans, but we give you some tissue to keep you covered up, and we use a probe just inside. It goes into the vagina but not up into the womb, but it gives us nice clear pictures of the womb and outside of your womb. When you come for these scans, we will explain what's needed on the day and talk you through those examinations. This is the ultrasound room that you'll come into at the early pregnancy assessment unit at Rotherham. This is the ultrasound machine that we use, and these are the different probes that we use to get the images from your scan.